Okay, GI, digestive system. So the main learning goals for the GI system will be to compare the various components of the monogastric hindgut and foregut fermenters, as well as the ruminant. So if you can get to the point where you're comfortable identifying the structures within each and their function within each and how they differ, then you'll be flying with GI. So GI tract, also known as digestive tract, alimentary gut, no, alimentary canal, sorry, gut, and it's within the visceral cavity. Keep in mind the membrane that encloses the visceral cavity is the peritoneal membrane, unlike the pleural membrane, which encloses or encapsulates the thorax, encapsulates the pleural space. And the GI system essentially is a tube that runs from the mouth out to the anus. There's variations between species, and this is all depending on what that species eats and how often they eat. Through evolution, their guts have changed to compensate for eating all the time, like horses and cows, or eating sort of meal feeding as hunger comes up, like dogs and cats and regular monogastric species. So with that being said, we break it down into monogastric, and we have within that category, there are foregut fermenters and hindgut fermenters, and ruminants, which have multiple mixing vats, so fermentation vats within their GI tract. Examples of each: monogastric, we have dogs and cats. Pigs are monogastric. Monogastric foregut fermenters, and then for the hindgut fermenters, we have rats, a lot of rodents, including rabbits and horses. Ruminants, the ruminants we have at Seneca are the sheep, and normally we have cows as well, and they're ruminants too. So digestive tract functions: prehension, so grasping of food with the lips, tongue, or teeth. And if we think about it, an example of a species that grasps at food with their lips would be the horse. With their teeth would be the dog and cat and most carnivores. And with their tongue would be the cows. And the cows have really, really thick layer of papilla on their tongues that feels like sandpaper. And oddly enough, cows have long enough tongues that they can also clean out their own nostrils. And they do it regularly. Digestive tract function also includes mechanical and chemical breakdown of food, absorption of nutrients and water, and elimination of wastes. And this is always a good little slide to know for tests. Buccal cavity includes lips, tongue, teeth, salivary glands, hard palate, soft palate, and oropharynx. Say that 10 times fast. The salivary glands produce saliva, which contains some enzymes to help break down starches, such as amylase, and it also lubricates the food going down the digestive tract. So the salivary glands that most animals have are the parotid salivary glands, the mandibular salivary glands, and the sublingual salivary glands. And dogs and cats and carnivores in general also have zygomatic salivary glands. So this is also a really good image to know for tests and such. It's one that's easily labeled. And it's just identifying the locations of the various salivary glands. So just to remind yourself, salivary glands are those, if you think about a sour candy and your cheeks start to well up and you start to drool, that's your salivary glands working. So they respond to various receptors and stimuli to create saliva. So here we have zygomatic gland, which is unique to carnivores, so to dogs and cats. Sublingual gland, which runs along the mandible, underneath the tongue. And if you think about it, that's the one, some people press their tongue within their mouth and can, shoot saliva out from under their tongue. So that's that one. Mandibular gland is at the base of the mandible, the caudal aspect of the mandible. And then the parotid gland is just ventral to the ear canal. Just a quick note, when we do talk about lymph nodes and lymphatic vessels, whenever that will be, or if it's already happened, depending on what year you're watching this, the mandibular salivary gland can get confused with the mandibular lymph nodes, and it's tricky if you have a swelling of the mandibular gland. It might be misdiagnosed as a swollen lymph node, but you can get swollen mandibular salivary glands, and they're called mucoceles or saliceles. Teeth are involved in mastication, so chewing and physically breaking down the food into smaller pieces. Ruminants don't have any upper incisors, as you can see, or upper canine teeth. They do have molars and premolars back here. Instead of having the incisors, they have what's called a dental pad, and it's a really thick layer of connective tissue. It's a thick pad of connective tissue on the maxilla. Equine, looking at the equine, they have incisors, they also have canine tooth, and they have these tiny little premolars called wolf teeth. But other than that, they have a gap between their canines and their premolars. Some horses don't have their wolf teeth, some aren't born with them, and some have them removed if they have a bit in their mouth for riding. But just to know that they exist. So obviously when you're giving medications to these animals, it's always important to know where you can put your fingers and where you can't. Functions of the oral cavity is to prehend the food, mechanical and chemical breakdown of food, and to prepare the food for swallowing, and that involves the salivary glands and lubricating and breaking down the food. Digestive tract structure. So as mentioned before, the digestive tract is more or less one big tube that runs from the mouth out to the anus all the way through. And it's made up of numerous layers of tissue. It's not the most important, but there are lots of important layers. We have a muscular layer, which is outside the submucosa. So the muscle layer, keep in mind, the GI tract's mainly composed of visceral smooth muscle, and that creates that peristaltic wave that takes that food from the stomach or from the esophagus to the stomach and on down through the digestive tract. Other than that, we have the mucosa, which is the innermost layer of the GI tract. It's the lining of the GI tract. It's made up of epithelium and loose connective tissue. Really important with the mucosa, it's constantly producing mucus. So as you can imagine, having to continuously lubricate the GI tract to ensure that food is going down the GI tract, mucus plays an integral role in helping food along and also protecting the lining of the GI tract. And if we think about it with the stomach produces an excessive amount of mucus to help protect against the hydrochloric acid that would eat away otherwise at the submucosa. So the submucosa is a dense connective tissue in general. It may contain glands as well. We talked about the muscle layer, so then the outermost layer is the serosa, and that's a thin, tough connective tissue layer. Clinical application of knowing all the layers is if a surgeon ever has to perform a surgery on the intestines or on the stomach or esophagus, anywhere that all these digestive tract layers are found, they have to not only cut through all these layers, but it's incredibly important that they suture up all of these layers perfectly. And oftentimes when they're doing a foreign body surgery, they'll suture up the layers and then inject saline into a portion of the intestine and sort of pinch off either end around their incision just to ensure that it's leak proof, because clearly we wouldn't want any of the bacteria that's in the GI system or the acid in the GI system to escape through that tiny little incision and create peritonitis, so to create inflammation or sepsis in the peritoneal cavity. So this slide just talks about the combination of skeletal muscle and visceral smooth muscle. So it's a good idea to know where skeletal muscle would be found in the gastrointestinal tract and where visceral smooth muscle would be found. Peristalsis, I'm sure we've talked about in detail at this point. So it's that wave-like muscle contraction that's unique to visceral smooth muscles. And it propels the digestive tract contents along the tube ahead of them. So it's constantly pushing behind the bolus of food. The food is called a bolus when it's in the esophagus, and then it works its way into the stomach where it's called digesta, and then once it's in the small intestine it's called chyme, C-H-Y-M-E. In the small intestine it's chyme, it's still a liquid, and then in the large intestine it gets dehydrated quite a bit and becomes more fecal matter. This is a really great chart to know, especially for any testing situations. This is the monogastric foregut fermenters. It's talking about each major component within the GI tract and its functions, and it talks specific functions. So we don't get too much into secretions and such from the GI tract because I'm hoping that you'll cover that in physiology, but otherwise it talks about each individual component and its functions. So that's a good one to know. Moving on, we'll talk about monogastric species. So these are monogastric foregut fermenters. So examples would be the pig, that's my cat Moose, and a plate of food that he was apparently eating. And then dogs, of course, as well. And these are pugs in a blanket. This is from one of the spay-neuter efforts I volunteered with out west in a community that's disadvantaged and doesn't get any veterinary care. So somebody had numerous pugs that kept having more pugs, and we were lucky enough to get them all in and get them all spayed and neutered to stop creating aunt, uncle, cousin pugs of each other. But these are all examples of monogastric species, and specifically monogastric foregut fermenters. This is also a good picture to know for testing purposes. So looking at the esophagus and the stomach, they're closely connected. The esophagus enters the stomach on an angle in the cardia region. Okay, there's a sphincter in the cardia region, and that's called the cardiac sphincter, and that opens and closes during swallowing and vomiting, of course. As the stomach expands, so we've got various components of the stomach. The stomach's composed of the fundus, the body, and the pylorus. In general, the pylorus. Of all these components, the fundus, so the cranial most aspect, is the portion that expands the most. As the stomach expands, the fold of the stomach, so right about here, actually closes against the lower end of the esophagus, and that prevents the risk for, or reduces the risk for reflux. In some species, this fold is strong enough and it does not budge until that stomach is empty. It's strong enough to prevent vomiting completely. And an example of that would be the horse, rabbit, and rat. None of those animals can vomit. There's something else I was going to talk about. Oh yeah, the difference between vomiting and regurgitation. Something that's important to know. Just to keep in mind, vomiting is an active reflex. Sorry. Vomiting is an active reflex. So vomiting involves the abdominal muscles, involves the stomach muscles, and involves the muscles of the esophageal tract, the esophagus, sorry. And it's reverse peristalsis. It's an active reverse peristalsis where a lot of skeletal muscles are also involved in bringing that vomitus up. Regurgitation, on the other hand, is passive, and it's literally reverse peristalsis to a very minimal degree, if at all. And it's literally just that stomach contents coming back up. There's no abdominal involvement, and it's a very passive motion. And you'll need to know the difference between those two, the one that's active and one that's passive. Passive regurgitation is a lot different than vomiting in a clinical setting. If an animal is regurgitating all the time, that can mean one clinical abnormality, whereas if they're vomiting, it's a completely different story. So it's really important to know the difference between the two. So gastric motility uses, again, visceral smooth muscle in the stomach wall, and it responds to hormones, peptides, and nervous system controls. Sorry, I'm just looking at this one. So parasympathetic stimulation causes the fundus to relax and increases contractions in the antrum of the stomach. Sympathetic stimulation can cause a decrease in motility, called gastric atony, which is delayed gastric emptying. The stomach is made up of numerous layers, as we discussed before, but within the way these layers are arranged in the stomach, it has these generous folds all throughout the stomach. So this is an example. Those folds are called rugae. Okay, little folds all throughout the stomach. This is a split cross-section of a stomach to identify the rugae throughout. And the purpose of the rugae is to increase surface area so that the animal can take in more food. The stomach is nice and closed and compact when it's empty, and it can expand to expand significantly when it's full. So all that mucosa is able to expand and allow for greater intake of food and greater absorption of nutrients. Don't confuse rugae with reggae, or else you'll get it wrong on a test. Gastric dilatation volvulus. This is a really good video to watch. It's just talking about clinical symptoms of GDV. Clinical symptoms of gastric dilatation volvulus is a dog, normally it's a big dog, who has a barrel chest and a nicely tucked abdomen. and they're trying to vomit. They're just constantly pacing and panting, salivating, and they're just trying to vomit and not bringing anything up. That is an emergency. So if it's gastric dilatation volvulus, it means that the stomach has swollen, so the stomach is bloated with food. It can be water as well, or gas. And because that dog has such a large, we call it a barrel chest, the stomach's able to take on a pendulous motion. It's able to swing within that lower thoracic region almost. Swing, 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 and then it physically flips around upon itself. So the pylorus of the stomach is switched. It comes up near the esophagus. And as you can imagine, it's like twisting a candy wrapper open and closed. It's closed off at both ends of the stomach. So this is a severe, severe emergency. You can do surgery. The surgery is called, the surgery is where you have to unflip the stomach and then do a gastropexy. A gastropexy is when they actually suture the stomach wall to the wall of the dorsal abdomen to prevent that stomach from taking on that pendulous motion. Really scary, but everybody needs to know the clinical signs and that it's an emergency. Oftentimes you can see the dog bloating. That's his right side, but he's on his in lateral. So oftentimes it's on their left side that they bloat out. But you can get a dog. I had a Great Dane in at the Emerge Clinic, and it had all the classic symptoms of a GDV, but we didn't see any bloating. This dog was the thinnest, most tucked little abdomen dog in the world, giant Great Dane, and it just turns out that its stomach was bloated and really far up into the, pushing on the diaphragm in the thoracic region. So it was actually tucked up in the rib cage, and we weren't able to see it bloat out in its abdominal space. This is a very classic gastric dilatation volvulus x-ray. That means I need surgery right away. And this is a normal x-ray of the abdominal contents. Okay, moving on from the stomach, we have the small intestine, which includes the duodenum, also called the duodenum or duodenum. It's the first short segment that leaves the stomach. Duodenum is a really important segment of the small intestine. So it comes right off the stomach. And between the duodenum and the stomach is what's called the pyloric sphincter. Okay, so there's a pyloric sphincter down at the cranial aspect of the stomach. And you can see this interesting organ that sits within the folds of the duodenum. That's called the pancreas. And the pancreas looks like nothing, pretty much. It looks like more or less nothing, like mesentery that we'll talk about, until it gets inflamed. And when it gets inflamed, it causes big trouble for the animal. It's called pancreatitis when it gets inflamed. It can be caused by gastric intolerance, so GI intolerance, so feeding your dog the wrong food, them eating something that isn't good for them, they can get inflamed pancreas. So the pancreas has lots of roles. It has a role within the endocrine system with regulation of insulin and blood sugar. But in the GI system, it is really, really important for the duodenum because it secretes it secretes bicarbonate into the duodenum. And what that bicarbonate does is neutralizes the hydrochloric acid that's coming from the stomach. So if we didn't have the pancreas, the stomach would be dumping hydrochloric acid directly into the duodenum. The duodenum does not have enough mucus production to protect it from the hydrochloric acid, so it would eat through all the mucosa and the submucosa and burn it, essentially. So the pancreas secretes bicarbonate into the duodenum to help neutralize that acid. Also in the duodenum, the liver, which hangs out cranial to the stomach, the liver creates bile, and it sends it to the gallbladder, which is a little organ within the liver, within the folds of the liver, and the gallbladder is where bile is stored. So the gallbladder then secretes bile into the duodenum to help emulsify fats. That's another important thing to know. The jejunum is the longest portion of the small intestine, and the ileum is separated from the colon by the ileocecal sphincter, or the ileocecal junction is acceptable as well. And that regulates movement of materials from the small intestine into the colon, or into the cecum. Sorry, no, it shouldn't even be colon, into the cecum. Okay, a couple issues that can happen with GI tract. So with intestines specifically, in small and in large, you can get something called intussusception. And intussusception is when the intestine telescopes upon itself. So it actually encases itself, it folds into itself. So it doesn't completely block the GI tract, but it narrows the GI tract significantly. You tend to get intussusception if an animal is having trouble regulating their motility within their GI tract. So an example would be an animal that's had severe diarrhea. They can get an intussusception. A dog or a cat, normally dog or cat, could be horse as well, from a heavy parasite burden can get intussusception as well. So anything that affects gastric motility and GI motility can create a problem with intussusception. So if you look back a couple slides ago, there was an x-ray of a normal abdomen. This one is very abnormal. So this x-ray is incredibly abnormal. We have lots and lots of small intestines and tons of gas. The black, see up here, is the lungs. So this that indicates air. So again, down in the lower abdomen, we have tons and tons of air throughout the abdomen, throughout the intestines, the small intestines. So what that ended up being is a linear foreign body. And this is what the small intestines look like with a linear foreign body. A linear foreign body means something that's long and making its way through the intestines, and it's intact. So it's this long foreign body that's working its way through the intestines and catching through peristalsis. It's catching on the muscular waves, and it's catching on the various folds within the small intestine. So have a look at this image. A good example, by the way, is string in a cat. That's so detrimental. If a cat eats a piece of thread, because as that thread is going through the small intestines or through the large intestines, peristalsis keeps working. The thread can get caught up with chyme in the small intestines, so a chunk of the thread can stay, let's say, in this area. Peristalsis keeps pushing the rest through, and the intestines are going to try to stretch out rather than be folded like this, and that thread can actually slice the heck out of all the small and large intestines. And then you have about 40 tiny little lacerations in the intestines that have to be fixed. It's really, really horrible. So have a look at this picture. These are small intestines. Those are normal small intestines. They're happy, they're pink, they're not folded quite a bit. And then this is a linear foreign body. So you can see it's corrugated. When they take it out, it looks like this. This is coming out of the large intestine. This would be a linear foreign body as well. So that string, or whatever it was, has collected with fecal material, with chyme, and it's created this huge, huge, disgusting mass that cannot flow through the GI system. Number one clinical sign of a foreign body, so a blockage in the GI tract, whether it's in the stomach or in the small or large intestine. Number one clinical sign that you'll see as an RVT is vomiting. Okay, vomiting, vomiting, vomiting. And then vomiting, not eating, lethargy, starting to go downhill. But vomiting is always number one. If you have a vomiting cat, always really important when you're doing your physical exam, have a quick look in the mouth. Check for string. If they have string, sometimes it'll catch on their tongue and won't be able to work its way down. So check on the upside of the tongue and underneath the tongue as well when you're doing your physical exam. Okay, carrying on. So the small intestine, within the mucosa of the small intestine, and the large intestine too, are tons and tons of villi. Okay, so these little finger-like projections are called villi. And on them they have these tiny little ciliated brush border cells called microvilli. And the main goal of the villi, again, is to increase surface area, but also they're responsible for absorption and secretion. So each villi has a blood network, so it has veins and, tiny little venules and little arterioles working on a capillary level within the villi. And they have it's called a lymph vessel or lacteal as well within each villi. And that exchanges lymph material and lymph cells. And this is all in the chart that we talked about earlier, the small intestine digestion. And then we have the large intestine. So the large intestine is broken into three components. It is the cecum, the colon, and the rectum. There is a lot of species variation between these three components in hindgut fermenters, foregut fermenters, and ruminants. So we'll go through them one by one. Right now we're just talking about monogastric foregut fermenters, so dogs and cats. So the cecum is a blind sac at the ileocecal junction, and what that means is it's literally just a little sac that hangs off the large intestine. Okay, so food can go into it, and then it comes back up to the opening of the cecum and works its way down through the colon. This is the ileocecal junction. Okay, so you can see the ileum, thin, small intestine. There's a tightening, a little stricture, and that's the ileocecal junction or ileocecal sphincter, and then we have the cecum. After the cecum, it works its way through the colon, and that's where some microbial digestion happens, absorption of water and electrolytes. And also in the colon, there's lots of bacteria, and some of that bacteria actually creates vitamin K. And vitamin K is necessary in producing clotting factors for the blood in the body. Just to note, the cecum is very poorly developed in carnivores. Okay, it's really important to look at this dog in general and understand where everything is within the abdomen. So having a look, the esophagus comes off the mouth slightly ventrally, and then it moves dorsally compared to the trachea. Okay, esophagus is dorsal to the trachea. Works its way into the stomach. Cranial to the stomach, we have the liver. Caudal to the stomach, tucked between the stomach and the small intestines, we have the spleen. And then ventral caudal in the abdomen, very, very ventral, is the small intestine. The large intestine starts within this bundle about here. The cecum would be here. And then this is large colon, or colon. Okay? This would be the rectum, and this would be the anus. So when we're talking about large intestines on a test, don't label all of this large intestine. Okay? This is colon. The cecum would be within here somewhere, and then the rectum is the storage area. A good question that is asked is, how does everything stay within the abdominal cavity without getting tangled upon itself? If you think about the numerous meters of small intestine that are present, it's hard to imagine that it doesn't get tangled and knotted as the animal's moving around. So having a look at this image here, you can see it's nicely bundled up. And in the middle, what's connecting all of it is called mesentery. Oops. So this is mesentery, and this is small intestine. So mesentery is a network of connective tissue. It stems from the dorsal wall of the abdomen, and it actually suspends the gastrointestinal system. So it suspends it kind of like a marionette, and it keeps it well organized, and it keeps it secure and prevents it from tangling upon itself. So mesentery is made up of connective tissue. It has fats that protects, thermoregulates, and then protects the vessels as well. Has arteries and veins, and there's actually the mesenteric artery that branches from the aorta. And then it has lymph vessels through it as well for lymph exchange. This is identifying the blood supply within the mesentery. And in animals, so the other is called the other thing we normally talk about. So we have mesentery, which is the general suspensory ligament, more or less, ligament sheets that suspend the large intestine and the small intestine and various structures within the abdomen and the peritoneal cavity. Then we have the omentum, and the omentum is specific to the stomach. So the omentum suspends the stomach to the dorsal wall of the abdomen. And cats and dogs, all animals, also have omental fat. So omental fat we talk about during surgery, and it's a giant fat pad that lives along their ventral abdomen. So looking at a cat like this, happy cat like this, when the surgeon would go in to perform a spay procedure, let's say, the first thing that they're faced with is omental fat, and it can be quite thick depending on the size of the cat or dog or mammal in general. So this is another chart to get to know. So now we're moving on to monogastric herbivores, aka hindgut fermenters. So by monogastric, it means that they still only have one stomach. But these guys utilize their cecum a lot better, a lot more efficiently than a canine or a feline would. So looking at our setup here, this is our horse who's a hindgut fermenter. We can break it down from small intestine, stomach, esophagus would be the foregut, cecum, large colon, well, yeah, technically for the horse, cecum, large colon, small colon, rectum would be the hindgut for these guys. Some examples, not so much Ron Burgundy, but his horse, in fact, is a hindgut fermenter. Rabbits are hindgut fermenters. Rats are hindgut fermenters. By the way, this is Ringo. He's my rat that I adopted from Seneca a few years ago. I just want to put it out there that all the rodents are up for adoption and seriously need homes. So if you're interested in one of these cute little hindgut fermenters, contact the adoption club because we would love to see them all get homes. And also capybara, which is a giant rodent, an aquatic rodent. But these are all examples of hindgut fermenters. Now I have this term up in the right corner, cecotropes. Cecotropes or cecotrophs, with a PHS at the end. Those are animals that excrete a little, it's called a cecotroph, and it's this tiny little pellet of what looks like feces. It's slightly different color, but it's still nutrient rich. So they use a strange process of reverse peristalsis between their cecum and their large colon, where this tiny little pellet goes down to their cecum from their small intestine, starts some fermentation, goes through their large colon, and then back up to their cecum, and it continuously has that back and forth. But in the process, so that's their normal fecal process, some of them, these little nutrient-rich pellets, don't get passed back up to the cecum, and instead they get excreted out. The animal ingests them again, so they're eating a little cecotroph from their anus. They'll eat that again, get all the nutrients, and then excrete it as feces. So those are interesting little guys. An example are rabbits, certain rabbits, and guinea pigs are cecotrophs. This is another good one to know. So this is the large intestine hindgut fermenter. This in particular is the horse, but they are more or less the same between species. So we have the beginning of the small colon, and then we have the right dorsal colon. Oh, sorry, I'm coming at it the wrong way. My apologies. That's the caudal aspect. So this would be the cranial aspect. We have the entrance at the ileum, which works its way into the cecum. So this is what I was saying about the cecum being a blind sac. So this is the entrance, the ileocecal junction into the cecum. It works its way through the cecum, which is a sac, comes back up, and then starts making its way through the colon. Okay, so this is the right ventral colon. Haustra are little striations, so those muscular divisions within the colon. So it makes its way through the right ventral colon, past the sternal flexure, up through the left ventral colon, continuing on. Then it becomes the left dorsal colon, the right dorsal colon, pardon me, and the beginning of the small colon. And the small colon is more dorsal and it's more caudal. This is how it's set up. Another good one to know for a test. Okay, so we've got pharynx, esophagus makes its way down into the stomach. We have the liver cranial to the stomach. The spleen is caudal to the stomach. Works its way through the small intestine. Makes its way into the cecum. Okay, works through the cecum, comes back up, and is excreted into the right ventral colon. It's called the ventral because it's more ventral compared to the one cranial to it. So right ventral colon, right dorsal colon, and works its way through, going around into the small colon and then into the rectum, which is the storage area. I just noticed that this image has diaphragm spelled incorrectly. It should be diaphragm. Okay, so now we're moving on to ruminants. This is a really good chart to know, as is the case with all of our animals. Example of ruminants, we have sheep, cows, depends, some species of deer can be, well, no, not deer, but deer type animals can be ruminants or they're hindgut fermenters. So definitely any bovine, any ovine species, so cows and sheep are ruminants. And this is a good image to know. this is your typical ruminant stomach. So we always say that they have 4 stomachs, but in effect they actually have one true stomach called the abomasum, and that functions the same way as a normal stomach in a monogastric species. So it has the hydrochloric acid, uses chemical and mechanical breakdown. But otherwise they have the reticulum, which is the most cranial. They have the rumen, which is the largest component. And then they have the omasum, and then the abomasum, which is the true stomach. So the reticulum is the smallest, most cranial compartment of the 4 stomachs. It's separated from the rumen by the ruminoreticular fold. So it's kind of like the fold that separates the esophagus from the stomach when the esophagus is, or when the stomach's full. The lining is composed of a honeycomb arrangement of folds, and the reticulum and rumen, they work together. So they have coordinated movements to get that food mechanically digested. This is that honeycomb appearance of the reticulum, and again, the purpose is to increase surface area so that this can stretch and allow for more ingestion of food. People eat this too. It's sold as, what's it sold as? Tripe. It's sold as tripe, but it's actually stomach. Okay, the rumen is a series of muscular sacs partially separated from one another by long muscular folds of the rumen, and those are called pillars. The pillars aid in mixing and stirring of ruminal contents. Again, you have those reticuloruminal contractions, and they allow partially digested plant food to be regurgitated. So they work again with reverse peristalsis. The food is swallowed, it works its way, let's go back a bit, works its way between the reticulum and the rumen. And the reticulum, if it senses, or if the body senses that the food is not digested to an adequate level before it goes into the omasum, then it regurgitates it using, it is regurgitation. Yeah, just thinking on that. Anyways, it uses reverse peristalsis through the esophagus, goes back up to the mouth, and continues to chew it, called chewing the cud. Okay, so again, comes in through the mouth, works its way down into the reticulum, into the rumen, and back and forth using those reticuloruminal contractions. The rumen is the big fermentation vat. Okay, that's where it has a lot of enzymatic and bacterial components that break down the food, can go back up, chew the cud, and then it works its way into the omasum and the abomasum, and then onto the small intestine. A few things to know. The rumen is located on the left side of the animal. So if you're concerned about a ruminant's GI motility, so if we think that they're not ruminating the way that they should, then you can listen with your stethoscope on the left side, and it's called the paralumbar fossa. That's right here. So it's this little triangle called the paralumbar fossa on the left side. This is where the rumen would be, and it can bloat out if the rumen is bloated, but otherwise it's a dent, or an indent, between the pelvis and the thoracic vertebrae starting. So the reticuloruminal fossa, the paralumbar fossa is where you place your stethoscope to listen for ruminal contractions. So looking at the rumen's covered with rumen papilla, which are responsible, they secrete enzymes for breaking down and for fermentation. And then we talked about the rumen being the big fermentation vat, so it's where the majority of the breakdown occurs, of the chemical breakdown occurs in the ruminants. The abomasum and the omasum, the reticular rumen contractions move ingest it into the omasum, and it's a muscular organ with many muscular folds. It breaks food particles down further, and it absorbs any remaining volatile fatty acids. It also removes the bicarbonate ions and absorbs some of the water from the ingesta. The abomasum, as I mentioned before, is the true stomach, and it functions almost the same as more or less the same as a monogastric stomach. This is what the folds of the omasum look like within the ruminant GI tract. This is just a little image talking about where that food goes, how it works its way through the GI tract. Probably a good idea to get to know that. Couple problems that can happen. One of them is a displaced abomasum. So the majority of cases occur soon after calving. So it happens in the cow after calving. During pregnancy, the uterus displaces the abomasum so much so that after calving, the abomasum has to move back to its normal position. And this, at the time where the abomasum is moving back, it can cause, that's where you have a displaced abomasum occur. So atony, so again, that's that decreased gastric emptying. So, or gastric motility, decrease in gastric motility, gastric atony of the abomasum. If the abomasum stops contracting and turning over its contents, you get an accumulation of gas, and the abomasum will tend to move up the abdomen. So it will tend to move dorsocranially within the abdomen. Okay, so this is what we're showing here, pardon me. So here's your normal abomasum. It's normally on the ventral aspect of the abdomen. Displaced abomasum, it sort of gets lost within the abdomen after calving because it has all that empty space to fill and it needs to find its way back. It can stay in the incorrect place, which is a displaced abomasum, and then you get that gastric atony, and it becomes quite bloated and can cause some pretty major issues. You can get bloat within the rumen, and bloat's very common. We tend to get it with our calves when we have calves at Seneca. And bloat happens in the rumen, and you tend to get a huge excessive bloating on the left-hand side. Now, as ruminants are ruminating, when they have food in their rumen and they're breaking it down, they can get a little bit bloated on the left side. That's normal. It'll go away. But bloat is when it becomes quite pronounced and it doesn't go away. So with that, some animals have a plug that's permanently installed in the rumen so that gas pressure can be relieved. With our calves, we often tube them and feed them an anti-bloat agent. And bloat can happen for all sorts of reasons. It can happen depending on their diet. If they have high fiber and they're not digesting it correctly, if their ratios are wrong within their food, it's not meeting their nutritional requirements, and they can bloat. And it's something that has to be looked at. This is an example of it's a plug in a cow, so it's a plug in its rumen, and again, it's a surgically installed permanent plug. And they used to have it at the Royal Winter Fair. This cow used to go everywhere. I think it's still at Guelph, they have one. But you can actually either look in it, they have a window into their rumen, or they do a lot of testing with medications, etc., looking at the ruminal contents using these plugs. So they'll take out the ruminal contents with a gloved hand and test them for if there's still volatile fatty acids present and various pH balances, etc. So those are kind of neat. You can look them up. Just look up plugs in cows. I just thought that was a cute picture, so I included it. Okay, again, good one to know, just knowing where all the abdominal contents are within the animal. And then we work our way past the large intestine, past the colon and into the rectum. And it's the terminal portion of the large intestine. Nervous system control of the motility and secretions similar to that of the colon, has lots of mucus secreting glands, and it lubricates and aids in the passage of contents, so in the passage of stool. Sensory receptors detect stretching and stimulates the defecation response. And at that point it shifts into the anus, which is composed of internal and external muscular sphincters. The internal sphincter is under autonomic control, external sphincter is under voluntary control, and specifically the external sphincter is solely skeletal muscle. Okay, it's under voluntary control completely. As the rectum distends, the stretch receptors in the rectum wall cause partial relaxation of the internal sphincter. The anal mucosal receptors increase the sense or need for defecation. And then it happens. So we have some accessory organs to the GI system, which are really important to talk about, but we'll only talk about them briefly. Liver is the big one. So we talked about the liver and the production of bile, creates bile acids, cholesterol, bilirubin, secreted into the bile ducts, onto the hepatic ducts, and then into the gallbladder for storage. Mainly to know that the gallbladder stores the bile and then the bile emulsifies fat in the duodenum. The liver also removes toxins, infectious agents, and so forth that enter the body through the walls of the GI tract, and it stores or metabolizes nutrients absorbed from the GI tract. Pancreas is another big one that we talked about. It produces pancreatic amylase, proteases, and lipase. It also secretes bicarbonate. That should be bicarbonate, not by... Oh no, sorry, my eyes are fading. Secretes bicarbonate into the duodenum, and that neutralizes that hydrochloric acid. And then it also works to produce insulin and glucagon, to help regulate blood glucose levels. That's it. So mainly the goals would be to know the differences between monogastric, hindgut, and foregut fermenters and ruminants, and be able to label a ruminant structure, be able to label hindgut, foregut structures, and know what each portion of the GI system does to aid in digestion. That's it.